We've lost our right to decide for ourselves whether we should have health insurance. As our big government gets even bigger, though, what else can our elected officials force us to do or not to do? Let's ask Republican Representative Michael Burgess of Texas. I got a great idea, and that is this. I think I want the IRS to go enforce a quota for people's own good. They need to watch more financial television, 2 hours of financial television every day. I want the IRS forcing that. What do you say?
You're supposed to say FBN. That's what you're supposed to say.
Or
financial television.
Specifically happy hour.
Well, I'm assuming it would trickle down. Go ahead.
Well, it would boost financial literacy, wouldn't it? And maybe that'd be a good thing for the country. But look, this is the first time we've invoked a financial penalty on people who choose not to engage in interstate commerce. That is, those people who decide not to buy health insurance. And it is a dangerous direction for the Congress to push this country in, for this country to be able to demand of its citizens that it buy things that they have no intention of buying and extract a financial penalty if you don't comply.
The representative, the left keeps pointing out that they require us to buy car insurance if we drive. And we keep pointing out, yeah, but you can choose not to drive. You can't choose not to be healthy. So what's next?
That's a state mandate, and that is a different animal. If a state wants to put even a mandate for health insurance, some do, and if those folks can get reelected by the good people in their state, then good for them, and that will be the way it will be handled in that state. But we do not have a national mandate for car insurance, and you're quite right. You don't have to drive on the roads, so you don't have to carry car insurance. But this is an entirely different animal where the federal government, not the state government, but the federal government is coming in, penalizing citizens for choosing not to engage in commerce, and that is an area where we really have not gone before.
But then where does it end? I mean, we as the taxpayers own General Motors. Maybe that will be the next mandate. We all have to go buy General Motors cars, and then just from there it spirals. We're worried about obesity. They're going to mandate liposuction pretty soon. How does this stop?
Well, they'll mandate that you not buy high fructose corn syrup or put additional taxes on it.
Right.
The cars will all be electric because of climate change. I mean, it really orchestrates a society that, I mean, most of us did not sign up for that type of activity when we began either our careers in public service or even just as a consequence of being an American, that they can now charge you something that you never really wanted to purchase in the first place. It is preposterous, and it's just an example of how far we've gone from what we should have been doing. I mean, what is the purpose of the United States Congress? Defend the borders and deliver the mail? And we've really gone far away from that calling.
Representative, I mean, what we're sort of all getting at here is it is a slippery slope, and I think what scares the hell out of me is I know you Republicans are going to start using this same logic, but you'll want us to buy guns and Bibles or something.
Well, an armed society is a polite society, so maybe that would be a good one. There is no stopping once you start this. It's hard to see where you draw the line and say, well, this is now the government gone too far. Today, the government has gone too far with the passage of this bill that was signed by the president. And look, in your previous segment, you talked about members of Congress who haven't read the bill. I will submit to you, no one in Congress read this bill. This bill was never intended to become law. This bill was a placeholder passed by the Senate on Christmas Eve to get them to conference where they could write the real bill. And unfortunately for the Democrats, after the election of Scott Brown, this was the only way they could find to get a health care bill passed. And that's what they wanted to do at any cost. And now we're finding what that cost is.
Congressman, talk a little bit about, we were in the very beginning of the show, we were talking about the companies that came out and told us how much health care was going to actually cost them going forward. And I think back to this. I think back to, was this the intention of the health care reform bill? Was it supposed to be $14 or $15 or $100 billion taken from corporate America and given to people who don't have health insurance? Seems like just a map and time program to me.
Well, they're on several levels. Now, of course, there is the direct tax on insurance companies and pharmaceutical manufacturers, where they have a specific amount of money they must pay every year as a consequence of this bill. Now, we all know that money will come out of the salaries of the CEOs and the lobbyists. It certainly would not go down to the ratepayer, would it? Well, it might, and there's no protection to the person who's buying insurance or pharmaceuticals from how that cost is going to be shifted. But then here's the other thing. Some of our larger companies have said, under Sarbanes-Oxley, we are required to inform our shareholders when we're taking a large charge off, and we're taking a large charge off with this bill, and so they have done so. And then what do? Henry Waxman in my committee says, well, you got to come in and testify under oath in our committee about why you have behaved as another congressional directive,
Right.
Sarbanes-Oxley, said you must. It's so nakedly intimidating that it's absolutely scary what the direction we're going right now.
But, sir, what worries me is what you said earlier, that the spigot was open. We said this 2 years ago when former Secretary of Treasury Hank Paulson came screaming into Congress and said, I need $700 billion, and we opened the spigot then, and it hasn't shut off by any stretch. Quite frankly, it's just pouring. We're pouring money out. So we've opened the spigot
Correct.
here now. This is not going to stop. I mean, there's no light at the end of the tunnel, is there?
Well, this is why the House of Representatives initially showed Hank Paulson the door and said no thank you. Unfortunately, they came back for another try, and they got what they wanted. But you're quite correct. The Troubled Asset Relief Program was a poorly designed, expensive product, gave new powers to the Secretary of Treasurer, and at that point, we didn't even know who the next secretary was going to be. In 4 months' time, we were going to have a new guy that none of us even knew. So it was a bad idea then. It remains a bad idea today. And you're right. It becomes very, very hard to turn the dollars off once you turn them on to the degree that they're on right now.
Representative, we're just out of time, but listen, aren't we just cutting corporate entitlement for health care entitlement? That's what these charges are anyway.
It may be, and if that's the case, then the corporations were entirely within their rights to restate their earnings. Why do they have to come up and testify under oath to our committee? This was not something they did to irritate the president or defame the president. They were simply behaving under a congressional directive, which is what the Sarbanes-Oxley law was.
Exactly. All right, Representative Michael Burgess, thank you very much, sir.
Thank you.
On tap, Cody has identity issues in his